So I wanted to address this comment. A 3 to 2 year pregnancy is not physiologically possible in the human body. Now, what is possible is a woman to falsely believe that she's pregnant for a certain amount of months, and then during the time that she falsely believes she's pregnant, she actually becomes pregnant because she's still active with her partner or her partners. And so she becomes pregnant during the time that she falsely is pregnant, and then from 9 to 10 months from that time, which is around 37 to 42 weeks gestation, she'll deliver. And in her mind, she's been pregnant that entire time. So if she thinks that she had been pregnant for 6 months and then she becomes pregnant, then she adds 6 months to a 9-month gestation. And then so that turns into 9, 10, 11, 12, 13, 14, 15, 16-month pregnancy, which technically is incorrect because she falsely believed that she was pregnant for a certain amount of time. This scenario is way more common than women want to admit and believe. Over the 9+ years I've been doing this research, I have come across this scenario so many times where women falsely believe they are pregnant for a certain amount of time and then get pregnant during that time, and then they add the time that they falsely believe they were pregnant to the gestation of their actual pregnancy, which makes it a very, very long, falsely long pregnancy. Now, I also want to talk about detected through Doppler and movements. Now, if your baby is big enough to be felt in movements, then it's big enough to be seen on ultrasound. So if you're feeling regular baby movement, then that means that your baby is big enough, and big enough to push not only against your uterine wall, but your abdominal wall, so that you are able to feel the movement. That means your baby is at least 1 pound to 2 pounds. That's very hard to miss. If you are finding that you are able to find a heartbeat with a Doppler, but they're not able to see your baby on ultrasound, a Doppler and an ultrasound are the same technology. So if you're saying that the Doppler is actually better technology than an ultrasound, that is false and a naive comment. Or it's naive to think that a Doppler can find a pregnancy better than an ultrasound can. And so if this is the truth, if your sis and your granny had pregnancies of years that can only be detected through Doppler and through movements, then they would most definitely be detected through an ultrasound. It's also very important to remember that as the baby grows, it gets bigger, and the bigger it gets, the easier it is to be seen on ultrasound. A baby might be missed at 5 weeks or 6 weeks gestation, but it definitely won't be missed by 12 to 15 weeks gestation. And then as the weeks progress, the baby gets bigger and easier to find. So as the pregnancy progresses, it's actually easier for the woman to prove that she is pregnant instead of the other way around. As the baby grows, it gets bigger within the abdomen, and a doctor can actually palpate the physical baby or babies. They can feel for the head, the bum, the arms, the legs. There's doctors who physically move babies into the position for birthing. So if they're able to manually maneuver a baby within the uterus from the outside, just using their hands moving, then a doctor can definitely confirm whether a baby is inside a woman's uterus or inside of her belly or not. That's just the way it is. So ultrasound or no ultrasound, a certified physician should be able to palpate the woman's uterus and confirm or deny whether there is a baby growing in there. Now, they can't do this at 6 or 7 weeks gestation, but they can definitely do it 20+ weeks gestation. And this is why I state that as the pregnancy progresses, it should become easier to confirm that there is in fact a baby and not the other way around. So as the woman becomes more pregnant, it's easier for her to prove that she is pregnant. It should not become harder to prove that she is pregnant as the pregnancy progresses. If you have any questions about this video, if anybody watching has any questions, please leave them in the comments. But I hope this helps clarify some misinformation that's going around on TikTok and online about pregnancy of years and pregnancy in general. So thank you for watching. Bye.